First of all, just speaking for myself, it's very eye-opening to be part of a meeting like this because medically and scientifically, I've lived my life with a silver spoon in my mouth. I went to the best institutions. I've never had to say, by and large, would I have to withhold a therapy from a patient because they couldn't afford it or it wasn't available? And I've been fortunate enough to work in labs that are the envy of the world. So therefore, to look at this, how are we going to translate? How is this science meaningfully going to apply to places that may not have access to these kinds of resources is a daunting question. And I must say, for myself, it's a bit presumptuous because I don't work in this area. This isn't my life's work to try to make some comments here for others who've spent years working on these areas. So you'll forgive me if I'm a little bit off about this. But I do want to talk about breast cancer because it's my life's work. And we need to understand when we say, how could science change the impact of this disease? I actually think in some ways that's the wrong question. Science has. We just haven't figured out, are we going to do it or not? Let me explain what I mean. 90% at least, 90% at least of all of the breast cancer in the world, wherever you come from, is due to environmental factors that are manipulable. 90%. If you look at countries perhaps 80 or 90 years ago, look at Japan in the 50s. Your average woman, 4'11", weighed 95 pounds. Her period started when she was 16 and a half. She was pregnant shortly thereafter because she was small and slight and didn't do hormone replacement therapy. She went through menopause around 44. 10% the risk of breast cancer of a Western woman, 10%. And it's not genetics because when they move to Western countries, their children have exactly the same risk. It's not genetic. We know what these factors are, and what puzzles me greatly is why there isn't some kind of will to do something about it. I had this discussion with Dr. Lopes. He disagreed with me, so he will have his chance to retort. But it's already known, it is proven with 20 years of follow-up that an essentially harmless pill, tamoxifen, can prevent, if you take it for 5 years, 50% of all breast cancer. 50%. Believe me, self-examination does bupkis compared to that, and mammograms are relatively ineffective on that scale. There are other pills for which there are now more than 10 years of follow-up that can reduce the incidence of breast cancer at lifetime by 75%. There are implantable versions of these pills, so you can just get a shot once a month. So I would argue the issue, we can talk about palliative care, chemotherapy, all kinds of other useful things, but if you just want to take breast cancer off the table, we can chemo-prevent it now. It's very simple. And I'd like to understand why it's cheap, it's unbelievably cost-effective. All of these analyses have been done. I think that this is a straightforward solution to the problem, which science has answered. All right, the second area that I want to talk about, there are only two, so don't get anxious. The second area that I want to talk about has to do with something that I think could really apply throughout the world, whatever the economics of a country are. 95%, at least in my personal estimation, of all of the research that has ever been done in cancer, 95% of all the people who've ever done that research has all been based on one single hypothesis. It's a wonderful hypothesis. It's brought us many new treatments, but it's only one hypothesis. And that hypothesis, very simply stated, is that a good cell goes bad. A normal breast cell becomes a breast cancer cell. A normal cervical cell becomes a cervical cancer cell. And if you tortured that cell enough, if you sequenced it, if you looked at its genome, if you looked at its epigenome, if you looked at it and studied it itself enough, you'd understand what made it a deviant, and through that knowledge, you could either reform it or kill it. It's a perfectly legitimate hypothesis. However, it doesn't explain a great deal of human breast cancer. It simply is inadequate. Because what is overwhelmingly clear scientifically, it's not just my opinion, is that things that happen to a woman in her life which the breast cancer cells cannot know about directly, will determine whether she gets breast cancer or whether it recurs. Let me give you some examples. A breast cancer just doesn't know if you get diabetes. A breast cancer just doesn't know if you get central obesity. Breast cancer doesn't know if you get a kidney transplant. Breast cancer doesn't know if you've had a terrible day and you're depressed. For 30 years, God help me, I have been lying to my patients. For 30 years. Women would come to see me, they'd gone 5, 6, 8 years, they're doing great. They come in, their breast cancer has recurred, this is tragic. And they say to me, I know why my breast cancer has come back. And I say, why is that? They say, here's the reason. My husband ran off with a secretary. My son is on drugs. I got riffed from my job at the University of Miami. I lost my job. And my immune system has been overwhelmed. I'm so stressed out. And for 30 years, God help me, I've said nonsense. I've said it because I didn't want them to feel guilty. But in fact, we now scientifically fully understand how inflammation, depression, central obesity, and diabetes can completely alter the environment in which a cancer cell either can live and survive and kill you, or stays quiescent or dormant. So that these are tremendous opportunities, not just for breast cancer, but across multiple tumors. These data apply to melanoma, colorectal cancer, gastric cancer, breast cancer, prostate cancer, and it's clear to me that public health measures that have to do with these societal and public health issues that don't seem directly targeted at cancer will have tremendous impact if we can harvest them and look into those. So those are my two main points. We actually do know how to prevent breast cancer if we only wanted to do it, and I would argue that some country is going to take the lead here. Maybe it is going to be Peru. Maybe it is going to be Mexico, and they're going to say, let's have a huge nationwide program to use drugs like tamoxifen, and I think it'll work. Thanks for your attention.